This year, the eligibility criteria for free COVID vaccinations has significantly changed. And apparently this has caused widespread confusion, with up to half of the patients who've tried to book their jabs being turned away. So let's make it clear. At the moment, you're only eligible this year for a COVID jab free if you're aged 75 or over, or if you have a weakened immune system, or if you live in a care home for older adults. And only last year, everyone over the age of 65 was able to get one free. But now they're being told to pay for the vaccine privately, which means it's going to cost about £100. And that, of course, is despite over 65s still being allowed to get their flu jabs free. Telling a pensioner to pay £100 for a jab sounds like you're asking for an awful lot of money, JJ.
You are. But I think I'd be more angry if they were taking away the flu jab. I think many more pensioners are affected by flu than are likely to catch COVID. So they're looking after the people who are going to be most at risk of getting COVID. So again, that's really good. And yeah, it's £100 is a lot of money. But if you're not in a care home, if you haven't got a weak immune system, then generally speaking, you're probably going to be okay.
I mean, that's a nice, confident thing to say. But of course, if you're a pensioner, you had it last year free. Anyone over 65 got it free. You felt comforted by it. Maybe you did survive the winter without catching it, or you got it only mildly and you felt good about it. You felt protected by it because you were protected by it. Then this year, you're told, well, actually, shell out £100 and go and get it privately. That's going to come as something of a shock, particularly, Penny, as you may be thinking that in wanting a COVID jab and asking for one, you're not just being selfish, you're also protecting everybody else from catching it from you, aren't you?
Yeah, I'm afraid I totally agree with JJ.
Afraid?
Quite often we don't. We have spirited discussions, do we not? But I agree entirely with what you said, because the point is that it isn't free, is it? Because we end up paying for it. And that means it diverts the money away from other things, like, for example, as you were talking about, flu. And COVID, although these two new strains aren't nice, there are other things around which perhaps we would be better off spending the money on. I think that's it, isn't it?
I wonder if you feel the same, Nicky, because £100 is an awful lot. If you're 65 and you had it free last year, you go and ask for it. They say, no, you've got to pay £100. How many people are going to shell out the £100? And how many people are just going to think, OK, I won't have it? That means, doesn't it, an extra burden probably on the NHS, more people catching it from more people carrying it around the place. Maybe this is not kind of forward-thinking, really.
First of all, I don't think 65 is old. I think that's quite young. But I think if you have the flu jab, it does boost your immunity and you're less likely to pick up COVID or anything else if you have that, and that is still free. I think the incidence of people dying from COVID between the age of 65 and 75 is reduced to such an extent that, as Penny said, the money does need to go elsewhere. We have to prioritise something, don't we? If you feel that you would feel more comfortable, then you have the option to buy it. So at least you've got that option. And yes, £100 does feel like a lot. But if it's a real priority for you, then I'm sure you would find the money to put into that. I mean, what is that? Food for a week. Okay, that sounds like quite a lot, but
£100 is a lot of money to spend on a jab that you got free last year. And the idea that you're 74, you've got to pay for it. You're 75, you'll get it free. I think lots of people think, oh, come on,
I think yes, but at the same time, I bet you that if you went along and you said it's affecting my mental health, for example,
I feel very vulnerable.
I live in a damp flat. I've had it before. I've lost my sense of taste and smell, whatever. I reckon that you could probably make an argument for getting it.
I don't know if that's true. I think it's a blanket situation where if you're over 75 this year, it's free, and if you're not, it's not. And you can't lie about your age to the NHS. They know how old you are, and they say, I'm sorry, we're not giving it to you this year.
But
you've got to shell out.
Flu jab.
But
you can have a free flu jab.
Which will boost your immunity, and something has to give.
Yeah, but the flu jab protects you against flu. It doesn't also protect you against COVID. It's not a generalised thing for any germ or virus.
I think if you pick up a cold, you're more susceptible, immunity goes down, you're more likely to pick up things like COVID. So, yeah.
Vanessa, where do we draw the line? Do we
say... Well, it's 65, where it is for flu and where it is for where you're practically drawing your pension.
And then a 64-year-old says, well, I actually don't work anymore and I'm not 65 yet, but I've got to pay £100. And we say, OK, If you're 64, then you can have it as well. Then the 63-year-old says the same thing.
Right, well, let's hear from somebody who is very concerned about this. Age UK has said the whole thing is puzzling, and it's led to many pharmacists saying they're facing major issues with people turning up for the COVID jab but no longer being eligible. And joining us now is the CEO of Age Scotland, Catherine Crawford. Catherine, I'm concerned about this. You can see my panellists seem to think that the line has been drawn in the right place pretty much. What do you think about it?
Well, I think we're concerned, and people have been phoning our helpline concerned and confused by the messages they've heard from the NHS about being called forward for a vaccination. Older people in Scotland still feel like they're really just out and about after the pandemic. So we don't want anything to knock people's confidence get back out into society and the community. So, and we know in Scotland alone, that's well over 500,000 people who are going to be knocked off the vaccination programme this winter. And we really hope that the NHS is really thinking about that as it's doing its winter planning, thinking what might happen if these people do get really ill and turn up at the doors of the NHS. And we all remember the footage from last winter with ambulances queuing round the car parks. We don't want that again for older people or for anybody in Scotland or all across the UK, in fact.
And Catherine, the idea that we can airily dismiss COVID as, not that serious anymore, they won't really be very ill even if they catch it, is that fair? Is that accurate? Is that true?
I mean, I'm not a scientist, I'm not a doctor. We recently had a meeting with Public Health Scotland, who work closely, obviously, with the joint vaccination programme. They did give us reassurance as to the science behind why decisions have been taken around changing the vaccination programme. But however we dress that up, people may not be dying of COVID, but people are going to be left feeling pretty unwell. And there's one group of people, older people in Scotland, we're particularly concerned for, and that's unpaid carers. Unpaid carers, week in, week out, hundreds of thousands of unpaid carers across the UK, providing well over 35 hours of care a week for their loved ones, who, if they pick up COVID, will probably be unwell, not able to do their caring duties, and who will feel really concerned and anxious.
Right.
And
one last question for you, Catherine. One last question, if you don't mind, is this. £100 for a COVID jab. In your experience, the people who have either gone to the pharmacy or tried to speak to their GPs to say, I'd like a jab, and they're told, sorry, you're not eligible, you have to be over 75 for a free jab, can they easily cough up the £100? Is that something they'll be able to do, or will many of them have to think very seriously about it?
I think the people calling our helpline are older people in Scotland. We know there are so many older people at the cusp of real financial poverty, and many, hundreds of thousands, in fact, living in poverty. It's tough. £100 is a lot of money. And if you think about unpaid carers who probably already had their income potential reduced by taking up caring responsibilities, £100 is not going to be easy to find. And I suspect the pharmacists will not see queues of people forming outside the clinics to cough up that £100 for the vaccine. So yeah, I'm concerned, and I really would urge the NHS and public health facilities to really watch out what's happening over the winter month and keep alert to be ready to deploy vaccination programme if required.
Catherine, thank you very much indeed. And I should just add, it's not just Scotland, it's the whole of the British Isles, England, Northern Ireland and Wales. All of them are saying now that you have to be over 75 to have the free COVID jab. Let's talk about this to Chris in North Yorkshire. Chris, what do you think about this? 75 years old, it's free. If you're under 75, it's not. You've got to pay £100.
I think the over 65s should have the COVID jab free. Because one of the main things is winter's coming on,
yes,
and they have to pay for the electric and gas, and that money for the COVID jab could have gone to keep them warm or for food, especially if you've got another parent, another relation who's ill, and that money could go to looking after those as well for like for carers.
Yeah. Are you eligible, Chris, for the jab free or not?
I'm not, no. Because I've got like a parent what is eligible.
Yes.
But there's, if they can't have it, then it's an extra worry on top of everything else.
Absolutely. Thank you so much for calling, and very much kind regards to your parent. Let's talk to Rose in Coventry about this. Rose, what do you feel? Do you think 65, as it was last year and as it is for the flu jab, is just about the right place, but 75 is too late, too old?
I think it's ridiculous. I really do think it's ridiculous. It should have stayed at 65. I'm 70.
Yeah.
I'm still working.
Right.
And that would still be a lot of money out of my pocket. But have they thought of another thing? People who don't have it are going to think if they, at Christmas time when it's cold and things like that, and they've not had the injection, they get ill, they're going to think they've got COVID. Where if they've been and had the injection, they're going to feel more secure. They're not going to be running to the doctors thinking, I've got COVID because I haven't had the injection and all this and that. That's another thing they've got to think of. I know I would.
I think that's an excellent point. Can I ask you something else? You're not eligible. You're too young. You're a spring chicken at 70. You're not going to get the free jab. Are you going to spend the £100 on having it?
Well, I will be honest with you. I can afford it because I am still working full time because financially I can't afford not to. Yeah. But I work in a care home with people with dementia. So, I will be having it.
Do you feel, as somebody who works in a care home with people with dementia, that you ought to be eligible anyway, just to prevent them becoming infected, that kind of a thing?
Well, yes, personally I do. I mean, I've got problems with my thyroid, but that still doesn't cover me. Gosh. And I think everybody who is looking after the elderly people who are more likely to get COVID should get it. Personally, I think it should be free completely. 100%. I don't think anybody should pay for it because it's got to work out cheaper in the long run. And I
also thought that the whole point about vaccinations is it's in everybody's interest. The more people are vaccinated, the better for every single person everywhere, right, Rose? Isn't that right?
I mean, we give children the measles injections and other injections. I mean, I've just had my pneumonia injection. That was free.
Yes.
And I'm going to have my I can't think what it's called now. Another injection. I can't remember what it is now. But I can have that next week. That's free. Shingles.
Shingles, that's it. Yeah.
But Rose, with measles, we have that as a child. Measles doesn't then mutate and change later on in life. The problem with the COVID jab is the COVID we had 2 years ago or 3 years ago is not the same COVID we've got today. So you're saying it's everyone's get it for free, but that means essentially every time we have a new variant, we're going to have to then spend millions, perhaps even billions, to have everyone vaccinated again and again and again. It's not the same thing.
But that's why we have to keep being vaccinated, because it keeps changing and mutating. That's why you have to keep being protected. And don't you keep hearing of people, really being properly ill with it? It's not kind of a glancing thing where you feel a bit off for a couple of days. Some people are still battling long COVID and they're feeling desperately ill.
And it definitely was. I mean, we know right at the beginning that it was actually much worse. I'm not trying to sort of downplay getting ill with COVID or anything else, but flu, for goodness sake. Flu can kill you. Yeah. So that is, and flu is still much more prevalent than COVID.
Right. Let's talk to Terry in West Yorkshire. Terry, what do you think?
Well, I think it should be free for everybody because I just had my flu jab and I got my COVID yesterday.
Right.
And it was free because what I've got angina and that, and my immune system could go down. But I can catch that COVID any time. So I thought I'd have the jab as well with my flu jab. And when I had mine done at chemist. And when I went in, he looked, he says, you are eligible, Mr. Tullen. I'm only 63 next. So, but I think everybody should be able to have it because this COVID's never going to go away. You know what I mean? It can still be passed on.
Tell me, how do you feel, Terry, having had the double vaccine, one for flu and one for COVID on the same day at the same time? How are you feeling?
Well, I felt a bit rough with my flu jab, like my nose and that running, but the COVID, I wasn't too bad this time because when I first had COVID jab, I was burning up and stuff like that. But I've had it this time and I've been okay. It's just my nose is a bit runny with flu.
Good to hear it. Let's talk to Mary in Oxford. Mary, how about you? What did they say to you when you wanted it?
Yeah, well, it's interesting this should be on today because I went to my surgery last Thursday in Oxford to get my flu
You sound as if you're mumbling a bit. We can't hear you properly.
Oh, sorry, I'm on a mobile. But I've got a dreadful cold at the moment.
Right.
It has coming on before I had my flu back. And it was last Thursday that I was told that they couldn't give me a COVID booster, which I'd had previous because of the change. But I did think, well, I would maybe go and get it from, Boots or somewhere. And I was meant to have gone last Friday, with the weather being so dreadful, I didn't actually go.
Yeah.
But I did speak to a pharmacist in Boots yesterday in Oxford, and she thinks that I might still be eligible because of various medical problems that I've got.
Okay, well, let's hope you are. Let's hope you get it for free.